Hypoxemia, also known as low blood oxygen levels, can be a life-threatening condition that requires prompt medical attention. If you suspect you may be suffering from hypoxemia, consult a physician right once. Hypoxemia is frequently brought on either by an environmental deficiency of oxygen or by a pre-existing medical problem that manifests itself in the form of symptoms that manifest in the lungs or the heart. It is essential for early diagnosis and treatment that you are aware of the warning signals that indicate low oxygen levels in your blood. Here in this video, we will discuss 8 warning signs of low oxygen in your blood. Number 8. Shortness of breath. It is possible for you to experience shortness of breath even during little physical activity or while you are resting, which is one of the most prevalent warning symptoms of low oxygen levels in your blood. This could be an indication that your body is not receiving the proper amount of oxygen, which in turn could point to a significant underlying health condition. Number 7. Rapid heart rate. A high heart rate is another indicator that there is a danger of low oxygen levels in the blood. While your body struggles to get by on the oxygen it has, your heart rate may increase above and beyond what is considered normal. You must get medical assistance as soon as possible if you discover that your heart rate is continuously raised. Number 6. Chest pain. Pain or discomfort in the chest is one of the symptoms that might be indicative of low oxygen levels in the blood, particularly if it is accompanied by other symptoms such as rapid heart rate or shortness of breath. Pain in the chest is a symptom that can point to a dangerous medical problem, such as a heart attack or a pulmonary embolism. If you're enjoying the video so far, please like and subscribe, and also leave a comment about which type of video we should do next. Number 5. Confusion. Confusion or trouble thinking clearly can be caused by low levels of oxygen in the blood, which can affect how well the brain functions. If you find that you are having trouble concentrating or making decisions, you may be suffering from hypoxemia. In this case, you should seek medical attention as soon as possible. Number 4. Headache. When combined with other symptoms such as shortness of breath or confusion, a headache can be an early warning sign of low oxygen levels in the blood. This is especially true when the headache is accompanied by other symptoms. You must seek medical attention if you are experiencing a headache that is severe or continues for an extended period. Number 3. Blue lips or fingernails. If you have low oxygen levels in your blood, one of the most prominent warning indications is that your lips or fingernails will turn blue. This is also a sign that you may have low oxygen levels in your blood. This can occur if the levels of oxygen in your blood are very low, and it is an indication that you need emergency medical assistance. If you experience this, call for help as soon as possible. If this takes place, you should get assistance as soon as you can. Number 2. Fatigue. When there is not enough oxygen in the blood, it can be difficult for your body to get the oxygen it needs to function properly, which can lead to feelings of fatigue and weakness. If you have been feeling unusually tired or weak, it may be a sign of hypoxemia, in which case you should seek medical attention as soon as possible. Number 1. Dizziness or fainting. If you are feeling lightheaded or like you might pass out, this could be an indication that your blood oxygen levels are dangerously low. This is especially important to keep in mind if you are also suffering other symptoms such as shortness of breath or confusion. If you have symptoms such as lightheadedness or dizziness, or if you pass out completely, you must seek the assistance of a medical professional right away. In conclusion, being able to recognize the warning signs of low oxygen levels in your blood is essential for early detection and treatment of the condition. You must seek immediate medical attention if you experience any of these symptoms to reduce the risk of developing serious complications. Low oxygen levels in the blood can be caused by several conditions, such as chronic obstructive pulmonary disease, COPD, pulmonary fibrosis, pulmonary hypertension, heart disease, and sleep apnea, to name a few. Hypoxemia can be caused by some environmental factors, including but not limited to high altitude, exposure to carbon monoxide or other toxins, and smoking. If you have a medical condition that puts you at a higher risk of hypoxemia, you must maintain close communication with your primary care physician to control your symptoms and avoid further complications. This may involve making changes to your lifestyle, such as giving up smoking or beginning supplemental oxygen therapy to increase the amount of oxygen that is present in your blood. You must seek immediate medical attention if you have any reason to believe that your blood oxygen levels are dangerously low. Your primary care physician can run tests to determine the underlying cause of your symptoms and then make recommendations regarding the most effective course of treatment for you. A therapy, also known as hyperbaric oxygen therapy, is when patients take in oxygen through a nasal cannula or mask. This may help to increase the amount of oxygen that is present in your blood and relieve the symptoms that you are experiencing. Medication to improve lung function, pulmonary rehabilitation, or treatment for an underlying medical condition, such as COPD or pulmonary embolism, are some of the other potential treatments for low oxygen levels in the blood. Maintaining a healthy body as a whole and avoiding exposure to environmental factors that can lower oxygen levels in the blood, such as high altitudes or pollution, are both important parts of the prevention strategy for low oxygen levels in the blood. If you have a pre-existing medical condition that raises your risk of hypoxemia, you must maintain close communication with your primary care physician to effectively manage your symptoms and avoid further complications. To conclude, having low levels of oxygen in the blood can be a serious condition that needs to be treated immediately by a medical professional. You can contribute to the prevention of complications and improve your overall health and well-being by learning to recognize the warning signs of hypoxemia and seeking treatment as soon as possible. Oxygen therapy as a supplement may be used to treat hypoxemia in certain instances. Hope you guys enjoyed our video. Make sure to subscribe to our channel and hit the bell icon for more videos. If you need more exciting and informative content, then check out more of our videos.